morning. Good morning. Welcome to Winning Wednesday. I am Professor Regina. I'm so happy to be studying with you today. If you're on your journey to passing the NCLEX and being an amazing US RN or LPN, this is the place for you. This is a global nursing study session, and we welcome whether you are a first-time NCLEX test taker, you are a repeat test taker, you are exploring your options for your global opportunities. If you want to go to the US, if you want to go to Canada, if you want to go to Australia, you have to take the NCLEX. And so I'm going to help you to pass that test. But let me know where you're watching me from, where you're studying from. I am in the beautiful country of the Philippines, as you know, and I am really excited about the classes that I have coming up. And who knows, I may be coming to a city near you. Today, we will be talking about aneurysms. We're going to be talking about aneurysms. And if you are my student, then that means you have my course. And my course is Quick Facts for NCLEX. This is the starter book. And so every nursing student should have Quick Facts for NCLEX. But if you are an audio-visual learner and you like things explained to you, that is where the V2 program comes in. And so this is my lecture workbook. And people always ask me, what's the difference between these two? Well, the difference is this is a question and answer book. So you can study it independently on your own. And this book right here is a workbook. So when you open it up, you will see a lot of the information is blank. And that is because you watch the videos that I do to fill out this information. So you never want to have just this book without the videos. You need the videos. And of course, if you're in the V2 system, it also comes with the question bank. And so you can see it on the back here, question bank on the back here. We're also going to do some questions from the Q bank right here on today. So it's a full system. And speaking of fullness, speaking of a lot of things happening, we have this month our NCLEX Masterclasses will be taking place in the country of Philippines. So Baguio will be just coming up April 4th, Manila, April 6th. I'm so excited. I have 800 people who signed up for that class. Cebu, April 8th, CDO, April 9th, and Davao, April 11th. If you are in the island, you can go to remarnurse.com/PH to sign up. And what I'll say is if you're coming to one of my classes in the Philippines, please get there early because we only have limited seating. So even though like maybe 200 people have signed up in, Davao, we are only going to have seats for so many people. So get there early. Doors open up at noon. I will be posting my countries that I'll be going to after I leave the Philippines. The Philippines is actually the first stop on my world tour. I will also be doing classes in, in so many countries. I also will be going to Dubai. I also will be going to London, Wales, Scotland. I'm really excited about that. I'm still working on Nigeria. I really want to get there. I'm still working on it, the partnership there. So you guys will be seeing me. Doing these master classes and helping international nurses pass NCLEX the first time. Now, for those of you who are in the United States, do you know what you need to be getting ready for? You need to be ready for Nurses Week. That's coming up in May. So I'll be doing a free NCLEX review and discount on my V2, especially as a gift for Nurses Week. So I'm really excited about that. If you want to sign up for Nurses Week and do the review and do the classes that I'll be doing, you can sign up right now. remarnurse.com/Nurses Week. So I am preparing things now for May. I'm preparing things now for the month of May, but let's get into it. Aneurysms. We are starting with this topic coming from Quick Facts. If you have your Quick Facts books, get it out because you will want to write these things down. As I was reading over aneurysms in the workbook, page number, where am I at? 8? No, not page 8. Page number 7. Okay, so when we think about aneurysms, it's great for us to start with the facts of aneurysm. So what is it? It's going to be a vessel that has had a weakening part of it, right? So it's a weakened part of the vessel. I have here in the walls of the vessel, you have this weakness. And so that begins to bulge. So, and I apologize if my Wi-Fi is not the best. I just want to say that right now. The Wi-Fi in the Philippines is, how can I describe it? It is special. It's special. And I'm learning as an international nurse how to work through it. So with aneurysms, though, this is a weakness in the wall of that vessel. And usually it's a large vessel. So I have here aneurysm is it's a dilatation, or it is a weakening form of the wall part of the artery. It is classified according to its shape, its morphology, and its location, and at least 50% increase in diameter. So, of course, the bigger an aneurysm is, the more serious the condition is. And we are expected to know how to care for these patients that have this interior malformation happening. And not only that, we have to understand that this is considered an emergency in most cases. When NCLEX presents this to you, it will no doubtedly be an emergency situation. So how do we act? How do we prioritize care during that? The common types of aneurysms, these are the 3 that you need to know. The AAA, which is the abdominal aortic aneurysm. You need to know about the thoracic aortic aneurysm and the cerebral aneurysm. And when I say you need to know about them, what I want you to be familiar with is the location and the complications. So if we're talking about the abdominal aortic aneurysm, we're talking about our patient possibly having a rupture that would stop the innervation or the nutrients going from the abdomen down. So that is the kidneys, right? The legs. This is a huge issue. Okay. If a patient has a thoracic aortic aneurysm, what type of symptoms would they have? What are the complications of something in the thoracic region, right? Because when we talk about an aneurysm, one thing about an aneurysm or an artery, when it ruptures, it bleeds a lot. There's a lot of bleeding. So imagine that blood in the thoracic cavity. Well, that's going to contribute to a patient having respiratory problems. They're going to have chest pain. They're going to have shortness of breath, right? And when we think about the cerebral aneurysm, well, we all understand the location, right? Cerebral. So we're talking about the brain, and we understand the aneurysm part of it. You have a brain bleed. We have a brain bleed. So what are the complications of that, right? Patients can have major complications with all 3 of these, right? So all 3 of these. So my job is to get you to critically think based off of stuff you know or you already understand. So if I asked you this question, who is the priority? Number 1, the client who has had an abdominal aortic aneurysm reporting back pain. I'm sorry, the client who has, not who has had, the client who has an abdominal aortic aneurysm reporting back pain. The client who has a thoracic aneurysm reporting mild chest discomfort. Or 3, a client with a cerebral aneurysm reporting the worst headache of his life. Who is our priority here? Now, I didn't give you the answer to this. I want you to think about it. I want you to critically think based off the facts, right? So if you know the facts, then you can answer this question. Correct answer is absolutely number 3. A client with a cerebral aneurysm reporting the worst headache of his life. So why is the cerebral aneurysm the worser? And I think worser is a word. Why is the cerebral aneurysm the worst? There it is, the worst. All right. So the reason why, and just thinking about it, this will make sense when you hear me say it. Okay. So in the brain, there is the least amount of space for bleed, right? There is the least room for pressure to go in the brain. Why? Because the brain is not a free floating organ just in your head. It is inside of what? What is the brain inside of? Right? The brain, good. The brain is inside of the skull. And the skull, not movable, right? So it doesn't have the space for additional fluid to go anywhere. It's not going to leak out, right? So that means that there is a very high chance of increased intracranial pressure almost immediately, right? And people who say, I have the worst headache of my life, this is meaning that rupture has happened. Okay. And typically after that, then they lose consciousness. And so anytime a patient has a brain aneurysm and it's a ruptured aneurysm, it is the absolute emergency. It's the neurological emergency, because even with surgery for a ruptured aneurysm, most people do not make it. The time is so limited that they have, because typically a person will have that cerebral aneurysm, it will rupture, and then they lose consciousness almost right after. So I personally I know someone who had this happen to them and they did not survive. So this is a medical emergency, all right? So when you're thinking about doing questions like this, look for the signs. NCLEX will always pair the condition with other signs. You may be asking, well, how does a patient get a cerebral aneurysm? Well, hardening of the vessels, right? Some sort of vascular injury can create weakening, hypertension, of course, uncontrolled blood pressure, increased cholesterol, smoking, kind of trauma. Sometimes infections or bacterial conditions can cause inflammation, right? That will weaken the vessels, a widespread inflammation, and neoplasms too. So aneurysms can be quite common. The diagnostic test here, let me see if I can just make it a little bigger. So if you're having a triple A in your patient, you would do an abdominal ultrasound for the thoracic aortic aneurysm. You can see that upon an MRI or CT or chest X-ray. Cerebral aneurysm, a MRA or a CTA. Okay. Great comments here. So the management, medication-wise, antihypertensives, you need to make sure that if we're talking about non-surgical, reducing the blood pressure is going to be the best. Okay, reducing the blood pressure. Now, let me ask you this. In patients with aneurysms, we want the blood pressure to be low. But what about the heart rate? Would we prefer the patient to have a high heart rate or a low heart rate with an aneurysm? Would you prefer for your patient to be tachycardic or bradycardic? What do you think? And I love teaching this. I love telling you this information and exploring these topics with you, because this is going to allow you to become a teacher one day yourself. Once you know the information, you can teach it. Once you feel comfortable with something, you can become the master of that thing. And so we're starting here so that one day you will be able to mentor somebody else in nursing. And that's what it's all about. So, of course, we want that blood pressure to be on the lower side, right? We want the vessel to have a nice little steady flow. We don't want tachycardia where the blood is flowing quickly through a weakened part of the vessel. So yeah. All right. So antihypertensive will be used. They'll lower the blood pressure and probably the heart rate, especially if the patient is on a beta blocker. Tell the patient to avoid lifting and straining activities, smoking cessation, and having aneurysm precautions. We don't want the patient doing any kind of heavy lifting. We also want to make sure that their diet is appropriate. Okay. Surgical options in abdominal and thoracic surgical repair can take place, and you would open up where that vessel is and do an endovascular repair or stent placement. You know, if the patient has a cerebral or brain aneurysm, could do surgical clipping and coiling of the aneurysm as well. Your responsibilities as a nurse: we are teaching our patient lifestyle modifications, as I said, avoiding activities involving lifting, straining, contact sports, pushing and pulling activities, smoking cessation, importance of blood pressure control, and surveillance. And then monitoring, you know, if you're taking care of a patient and they're in the ICU, you're going to be doing MAPs, mean arterial pressures, looking for early signs of hypotension, respiratory distress, and or paralytic ileus. And if patient has had surgery, after the surgery, signs of bleeding, severe pain, cyanosis, abdominal distension, oliguria, and paralysis. These things all would indicate if your patient is getting perfusion. Because, for example, if your patient had an abdominal aorta and it ruptured, then we know that you're not going to be able to put out as much urine because your kidney function is going to decrease. So just be thinking about things like that. Also, I would say look at also in your quick facts, look at the subject on page 53, which is meningitis, because sometimes NCLEX can give you two diagnoses that mimic each other. So cerebral aneurysm, patient's going to complain of head pain, maybe neck pain, stiff neck, right? And NCLEX will say, is this meningitis? Is this cerebral aneurysm? You need to be able to know the difference between those two. So it's in quick facts as well. Okay, nausea and vomiting can occur if your patient is having increased intracranial pressure or they're feeling unwell, as well as pain. Yes. Okay. So when this class is over, my expectation is that you dive deeper. You go back and you watch the videos and you read the quick facts book and you have a better understanding of the totality of what you're supposed to know for NCLEX. You have to be a generalist. And where I see nursing students go wrong, I'll say this over and over and over again, it is not applying themselves to the material. Either you don't have the material, which is just totally separate. You need to, you need to be able to invest in your education. Or two, you have my material, but you're not using it. You're not consistent. You're doing the YouTube videos, and then you're going to watch Mark Klemek, or you're doing this and you're reading quick facts, but when you close the book, you don't remember anything, but you just persist and pretend like you do remember stuff. And so You're not really being strong in your ability to push yourself further. Okay. And I will just say to you, you got to figure it out. Like, you have to do the work, because nobody is coming to take this test for you. Nobody, not even me, 24/7 can motivate you and pump you up to do this exam. There has to be something on the inside of you that wants to accomplish this task. And I cannot make the hard part easy. Okay. Now, I can make the information simple. I can explain it to you in 10 different ways, but the hard part of being consistent and following through, you have to do it. You have to do it. Okay. And it will help you greatly if you are able to sacrifice just a small amount of time, just a small amount of time. It will pay off the rest of your life. Okay. So do what you have to do in this program, get through it so that you are able to go on with success. All right. So before we leave, let's do some practice questions. I just want you to be able to look at questions with confidence. Here's number one. We're talking about aneurysms. We're talking about aneurysms here. So in caring for a client with a cerebral aneurysm, it is important to implement aneurysm precautions, which includes, number one, preventing constipation, 2, encouraging an iron-rich diet, 3, promoting regular walking, or 4, enemas as tolerated. What do you say, ReMar nurses? Put the comments on the screen. Yes, 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 yes. It's Winning Wednesday. It's Winning Wednesday. Correct answer is, did you get this one? Number 1, preventing constipation. Preventing constipation. And pray my strength about this internet. Oh man. Okay. Because I'm not seeing, everything is kind of like glitching, and I'm just persisting, hoping that it is well. All right. Preventing constipation. So clients with cerebral aneurysms, they should not do things that increase intracranial pressure. All right. Straining would be one of those things if they're constipated. Question number 2, a client with a thoracic aortic aneurysm suddenly reports hoarseness and difficulty swallowing. What is the nurse's priority action? I'm going to read it again. A client with a thoracic aortic aneurysm suddenly reports hoarseness and difficulty swallowing. What is the nurse's priority action? Number 1, assess the lung sounds and check for stridor. 2, notify the provider of possible aneurysm expansion. 3, apply oxygen at 2 liters and place in high Fowler's position. 3, reassure the client that these symptoms are common post-op. What's the priority action here? This is tricky. I said I wanted to, I want you to sit and have to think about this. And I want you to understand what I told you about this situation. And the correct answer is to notify the provider of possible aneurysm expansion. New hoarseness and dysphagia can mean aneurysm is pressing on the airway or esophagus. So this means an impending rupture is about to happen. Aneurysms are not to be taken lightly. They are not to be taken lightly, especially when a patient is reporting something new with an aneurysm. All out, get the doctor. Get the doctor. Because remember, patients have a limited time for treatment. Here we go. A client with a diagnosed AAA reports new flank pain and lightheadedness. The nurse notes a blood pressure of 112/66 and a pulse of 98 and pale skin. What action should the nurse take? Number 1, assess blood pressure in 15 minutes. 2, administer IV fluids as prescribed. 3, call the provider and report possible aneurysm leak. Or 4, assist the client to the bathroom before checking hematocrit. What are we going to do? What we going to do? We going to do number 3. Yes. I want you to understand that typically, I would say assess, right? That's your first step. I'm highlighting aneurysms because there is no strategy that works with NCLEX. You have to be able to know the information, right? So there's no hacks. There's no, airway breathing circulation. Those things are nice to know, but they don't always work. The nursing process when it comes to aneurysm doesn't work, okay? Because if somebody has an aneurysm and they have a new complaint, your assessment is not necessary first. What's necessary first is to call the doctor. I hope I'm making sense, because somebody else will say you always follow the nursing process. Not always. Aneurysms are a great example of when you don't. Okay. You're not going to sit there and try to get a blood pressure or try to get a temperature, ask the patient to rate the pain and then gather all that information and go call a doctor. These patients literally have minutes. Okay. So I hope that I made that clear today. That was one of the things I wanted to hammer in. As always, this episode is brought to you by the NCLEX V2 system. Is where I get all my information from. Is where I'm pulling these lessons from. So you need to go in and do that work. I'm so looking forward to this year. Do you know this is already the 4th month of 2025? Where are you at with your goals? I hope that you are rocking it. Because opportunities are just knocking at my door. Like they literally are chasing me down. And I want the same thing for everybody in our community. But you got to be ready for the opportunity when it comes. And if you are taking the NCLEX, you got to be ready for this big opportunity so that you can get to the next level of where you're supposed to be. And I'm going to be cheering you on, but you got to do your part. So again, we have some amazing things coming up for our community. Nurses Week is for my U.S. nurses. Right now, it will be starting May 6th. So remarnurse.com/nurses week. It's a little thing that we do here in the United States. And so I want to celebrate it with you all and have some free classes, some discounts, some giveaways, all type of good stuff. Sign up for it again. Did you see that? Sign up remarnurse.com/nurses week, everyone. Well, I am off to the next thing on my agenda here in the Philippines. And so just keep me in your prayers as I am moving about the country, that I am safe, all things are well. The kids love it. Everybody did pretty good on the flights. There was one point, it was a 17-hour flight. So there was like a point where my son was like, hey, Mom, I'm ready to get off. Like, I'm done. I had enough. I think it was like hour 12 into the flight. My 8-year-old was like crawling under the seats and trying to get off of the plane. He had just had enough. So well, we made it here and now they love it. So it's really, really cool. So thank you guys so much for taking this journey with me. We have places to go as our community is continuing to grow and ReMar is getting out there. So I truly do feel like the #1 NCLEX instructor on the planet, literally. So it's a good thing. I'll see you guys later, God willing.